Hello, I'm Johanna, and I healed and reversed my alopecia areata over 10 years ago. What's more is that since then, I've been helping thousands of adults and children in over 68 countries heal and reverse their alopecia, various types of hair loss with success, even in those with quote-unquote no cure. Healing can happen, and my proven framework shows you how, naturally and effectively. Follow along with me so that you can hear client testimonials, get inspired to what's possible for you, and dive deep into the latest research. Hello, everybody, and welcome back to the Alopecia Angel podcast. I am so excited to be with you here today. I am interviewing today Dr. Eric Osansky, who is a chiropractor, clinical nutritionist, and certified functional medicine practitioner who has been helping people with hyperthyroidism and Hashimoto's since 2009. He is the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, The Thyroid Healing Diet, and the Hashimoto's Triggers, and is the host of the Save My Thyroid podcast. Dr. Osansky was personally diagnosed with Graves' disease in 2008 and was able to restore his health through a natural approach, and since then has helped others reverse their hypothyroidism through his Saved Thyroid framework. So I'm very excited to bring Dr. Eric Osansky to the podcast so we can learn more, and you can also hear his insights in regards to the thyroid and how this correlates to hair loss, but much more just thyroid in general, because Hashimoto's in particular focuses and actually targets women much more than any other autoimmune disease. And if you don't know, Hashimoto's is the most common one, and it does really segregate women amongst, men fourfold, fivefold, tenfold. And so Hashimoto's is something that cannot necessarily be caught right away. A lot of times it takes a minute or two to figure out whether your practitioners are doing testing on you or not. And so testing for the thyroid, I'd say even if you've never had thyroid issues, even if you've never have thyroid in your family, I would always recommend to do a full thyroid panel. And as you get older, things start to shift, and it's not always, where you can lean on what's happened in the past. And so you want to always be on top of testing and always want to be on top of what's happening and what's shifting. And as women, there's a lot of things that shift. It's not just puberty, it's not just pregnancies, it's not just miscarriages, it's not just hormones, it's not just menstrual cycles, but then we also have menopause, you have perimenopause, you have all these different life changes that again affect the thyroid, that again affect so many things. And as you know, with one autoimmune disease, this can buddy up to a second and a third. And I know a lady who's 71. She's always had thyroid issues, always had Hashimoto's. And then all of a sudden at 71, now she has alopecia areata. And so the thing is that thyroid autoimmune loves to buddy up with alopecia areata. They're BFFs, they're best friends forever. Rheumatoid arthritis also loves to buddy up with alopecia areata. So there's a lot of different types of autoimmune diseases that love to buddy up with alopecia areata. And so today we will be talking about two of them, Graves, Hashimoto's, and then hyperthyroidism as well. So I can't wait to do this podcast and interview Dr. Eric Osansky.
All right.
So welcome, Dr. Eric Osansky. Thank you so much for being here. So let's start with who you help and how you got into this.
Yeah, well, thanks for having me, Johanna. Yeah, so my background is a doctor of chiropractic, and I did have just a typical chiropractic practice for about 7.5 years. Had no experience dealing with thyroid conditions, autoimmune thyroid conditions, but in 2007 into 2008, I was trying to lose weight. I was dieting, detoxifying. I wasn't crazy overweight. I was like 182, my ideal weight, like 165 to 170. And I was losing weight, and okay, everything seemed to be going smoothly. But then a few months into this, I was walking around a retail store and they had one of those automated blood pressure machines. I took my blood pressure, which was normal, but my resting heart rate was a little bit elevated, it was 90 beats per minute, and figured maybe it was because I was walking around. So I just, the next few days, would take my resting heart rate and it was anywhere between 90 and 110 beats per minute. And at the time, again, I wasn't too familiar with hyperthyroidism and Graves, but I knew something wasn't right and I was losing a good amount of weight. Again, I was attributing it to what I was doing, but ended up seeing a primary care doctor, had some just really at that point basic blood tests. He ran like a TSH, free T4, but it was enough to confirm that I had hyperthyroidism. Eventually, I saw an endocrinologist, got diagnosed with Graves'. And even though I didn't have experience personally dealing with Graves' or seeing people with thyroid or autoimmune thyroid conditions, as when taking my continuing education credits, I would always take nutrition or functional medicine seminars. And I attended a few functional endocrinology seminars where they did talk a little bit about hyperthyroidism, more so about hypothyroidism, Hashimoto's, just because it's a lot more common. But it was enough where I knew that there was hope to try to reverse Graves' and not just manage it, or in some cases they remove the thyroid or do what's called radioactive iodine. So I didn't know if it would help. Like, again, I was skeptical because I didn't know anybody who took a natural approach. But long story short, I made some dietary changes, diet and lifestyle changes, did some testing, took some supplements, was able to restore my health, and then started working with others with thyroid and autoimmune thyroid conditions. And here we are.
There we are. Fantastic. Well, wonderful. So your Graves is in remission currently?
It is, yeah. I've been in remission since 2009. I do my labs every year. I mean, I've had some scares along the way, had some infections like chronic Lyme disease, COVID pneumonia, where I thought I might relapse, but thankfully things have remained stable.
That's amazing. That's amazing. I love that. And I love hearing that and sharing your own story as a testimonial, because a lot of times people think, "Oh, I have an autoimmune disease. This is like my fate or my destiny for life." And it doesn't have to be. Your diagnosis is not your destiny. And so I really want to broadcast that out to the world, because a lot of times we are scared and we just believe the first doctor or the second or the third or however many doctors that are giving the negative approach, telling us what they believe, and they're just going off of medical textbooks. They're not using diet and lifestyle. They're only going to give you the medications, or maybe they want to ablate the thyroid, or maybe they want to do something harsher. And so this is the situation. So I love showcasing that yes, you can put into remission various types of autoimmune diseases, including Graves' and yours. So when it comes to Hashimoto's, this is a big one that I come across a lot, because when people come to me, many times they have a second or a third or even a fourth autoimmune disease. And I'm sure you see the same in your own practice. It's not just one, but I will say that the thyroid is a big one for women. Can you talk a little bit about that and why it's a big one for women, why Hashimoto's is on the rise, why it's number one for women or in the US in general?
Yeah, I mean, great questions. And you're right. Hashimoto's the number one autoimmune condition, definitely more common with women, and not just Hashimoto's, it's most autoimmune conditions. There's a few exceptions. There's type 1 diabetes, I believe, is more common in male. You would know, I assume alopecia areata is more common in women than in men, but so that's another one. But yeah, most of them are more common in women. So it seems that, I mean, there are genetics behind it with autoimmunity. There's what's called the triad of autoimmunity, a three-legged stool of autoimmunity, where you have that genetic predisposition, exposure to one or more environmental triggers, and then that leaky gut component, that increase in intestinal permeability. But hormones do seem to play a role on why women develop these conditions more. And we do a lot of times see it during certain transitions, especially like perimenopause and postmenopause. Again, not to say I don't see, I mean, I see also women who have Hashimoto's as well as Graves' in their 20s, 30s, even sometimes, sadly, children and teenagers every now and then. But I mean, hormones definitely, like estrogen, sometimes it gets a bad rap, but it is important for immunity. And so when someone makes that transition from premenopause into perimenopause into postmenopause, and you get the fluctuations in estrogen, that can make it more susceptible. But at the same time, it's only a piece of the puzzle. Like again, to me, sometimes I'll hear where they'll, like, some will talk about hormones almost as being like triggers, like postmenopause as being a trigger, or these transition periods. And I mean, if that was the case, I mean, we already have a lot of people dealing with autoimmunity, but we'd have a lot more. So
True.
there are triggers, and that's leads to another one of your questions. Why do we see that increased incidence in autoimmunity? Not just Hashimoto's, but other autoimmune conditions. And I think a big reason is the toxic world we live in. I mean, there are other reasons too. There's infections, there's stress, just stress in general. I mean, certain foods, could potentially be triggers, but I mean, we could do things to minimize our exposure to these, but we can't completely eliminate our exposure, and they're just getting worse. So we definitely need to do things to reduce our toxic burden. But I think that's one of the big reasons why we have the increased prevalence, not just in Hashimoto's, but also, again, with most other autoimmune conditions, just mainly the environment that we live in.
So I was reading a research paper, and it said that postpartum, you have like an 18 to 20% increase in Hashimoto's. And that baffled me because as one of the testings or things to look at, not just during pregnancy, but postpartum, no one's talking about the thyroid. No one's talking about how things move around, and even with hormones, there's not a lot of discussion. I mean, as someone who had her baby at 40, abroad, mind you, not here in the US, but abroad, there was like no discussion whatsoever of thyroid or hormones. The testing was limited, and all this research that I did was on my own for my own sake and also for my client's sake. But the situation, I think, is a lot more vast in numbers when it comes to autoimmune diseases. I think that people are not realizing that they have one, and they're going through life debilitated, feeling fatigued, feeling awful, essentially, because they lack testing or they lack the awareness of that it could be something bigger. You had the awareness, the self-awareness to say, oh, something's up, and so you got checked out. But most people muscle through it. Most people think, oh, it's just a bad day. I slept wrong. It was the pillow. It was the, I don't know, glass of wine. It was XYZ. And they muscle through it. So do you have any statistics to share in regards to like how long it takes for an actual diagnosis? When it comes to alopecia, you can diagnose immediately. The hairdresser diagnosed me in the salon. So in terms of thyroid, though, I know this could be something that maybe goes hidden until it's not. But at what point, like how many months, years does it take for somebody to actually say, oh, it was my thyroid?
Yeah, another great question, because there is the silent autoimmune stage where you have the development of the autoantibodies, that autoimmune process. But unfortunately, most medical doctors don't test autoantibodies initially. I mean, they go undetected. And so people with Hashimoto's especially, they could go, it's not uncommon to go 5, 10, even 15 years before being diagnosed. Graves', I mean, Graves could go a long time. It usually people catch on a little bit quicker, because you're right, like with Hashimoto's, if someone's having fatigue, weight gain, for example, two of the more common symptoms, they might attribute it to, oh, well, I'm just working too hard, not getting enough sleep, I need to change my diet, or, I'm just getting older, so my metabolism isn't what it used to be, and, all these excuses. And again, it could be related to some of those things, but with hyperthyroidism, if someone has, like when I saw my doctor, I had an elevated resting heart rate and eventually palpitations and a lot of weight loss, it's more alarming. So usually they'll go ahead and do the testing, but not always. I've had people with hyperthyroid symptoms and doctors not even test thyroid and saying it's, you're anxious, maybe you need to see a psychologist or psychiatrist. So sometimes that gets misdiagnosed. But yeah, it could definitely be a long process. And part of the reason is also the testing is flawed. So with Hashimoto's, just in general, like when they do, let's say a physical, many times they don't look at thyroid. And if they do thyroid testing, they'll just do TSH, thyroid stimulating hormone, which is, as you know, is a pituitary hormone. And so TSH, especially for Hashimoto's, many times it's within the lab range, but not within the optimal range. So it might be like 3.5, 4.0, which is usually within the lab range. And so most doctors pay attention to the lab range, and they'll say, oh, no, your thyroid is fine. But if they were to test the antibodies for Hashimoto's, in all likelihood, those antibodies would be positive. And then the thing is, even in that case, many medical doctors wouldn't do anything because they're not doing anything for the immune system. So they might just tell the person, well, right now your TSH is looking good according to the lab test. So let's just go wait and we'll retest it in a year. And then if it's out of range, we'll put the person on thyroid hormone replacement. So it's really a backwards system here. And we should be doing what's called like predictive autoantibody testing, where we're looking at the antibodies, and if they're normal, great. But And since Hashimoto is especially so common, to me, that should be part of a physical, part of that exam, doing a full thyroid panel too, not just TSH, but T3, T4. But like I said, usually it gets missed, and most doctors will dismiss the symptoms. And so that's why many women do go quite a long time before that diagnosis.
Yes. At what point would you recommend, let's say if you had, children or nieces or nephews or just loved ones or just even your clients, at what point do you say, oh, by the age of, I highly suggest you checking for a full thyroid panel and getting that how often?
Yeah, I mean, it's a great question because we see now, unfortunately, because of some of the factors we mentioned, more children and teenagers getting these autoimmune conditions. So if someone does have, especially a family history of Hashimoto's, like if someone has personal history, a woman has Hashimoto's or Graves, or really another autoimmune condition, then they probably want to do it. I mean, I don't know if they need to do it like really young, like, 6 years old or 8 years old, but I would say definitely, if not that soon. I mean, it also depends. Honestly, one of my young daughters just still very difficult to get blood drawn, and again, now she's a teenager. So again, it's not just the children. Sometimes the teenagers still don't like to give blood, or again, really could be difficult to do blood work. But I mean, if you could do it early, I mean, if you could do it like even like 8 to 10, like if let's put it this way, if they're getting blood work for other reasons, yeah, why not? Like if they're going to, get at 6 years old, 8 years old, if they're getting a checkup by a doctor, getting some blood testing, let's do it. If they're not getting blood work, I would say definitely by the time, they're a teenager, because again, that's one of the transition periods with the hormones. So I would say it's a good idea to do not, again, just TSH, but a full thyroid panel with the antibodies.
For both men and women, or boys and girls in this case, just because it is puberty, or more so for women versus boys?
I mean, if there's a family history, I would say, yeah, like men, it's so less common to have Hashimoto's and Graves, but it still happens. I mean, I'm a perfect example. I'm one of, now again, it didn't happen during puberty for me, but it does happen with some men. So I would say, yeah. I mean, I don't know, again, across the board for every child and teenager, but again, if you're doing blood work, I would say yes. Why not? Why not just run the antibodies? But should they take a separate trip at like 10 years old or 12? Again, let's say 12, 13, every male and female. I mean, I'm a little bit biased. I would say it's probably not a bad idea just because, again, it could be, we mentioned it could take 10, 15 years to develop. So if a teenager has it, they might not find out with the system the way it is until, their mid 20s, let's say, even if they do have the auto antibodies at that young age. So yeah, I would say if there's a family history, especially, I think it's a good idea. If you don't have the family history, maybe not as urgent in men, but again, I'm all about prevention. So, and just as you are
Same.
too. So rather than waiting for, so to me, it would be if you have a child that's willing to, you're not dragging to the lab to get the blood done, then I would say, yeah, try to get it as early as you can within reason.
And if and when you do have a Hashis or a Graves diagnosis, would you recommend every 3 months, every 6 months, every year after that getting tested?
If you have the diagnosis, actually, I didn't answer your other question. So let's say it comes back negative, because I think also you were asking how frequently do you test? So if it's negative, then I mean, again, you could do it once a year. A teenager might not be getting blood work every single year, but if they are, why not still keep up with it, test for it? But I would say at least every 2 or 3 years, probably no more than like 5 years. Again, just it depends on obviously the parent and the child. Sometimes, like I said, it could be difficult getting them to get blood drawn. But I mean, if you already have the diagnosis, then especially while you're working with me or someone else, I think it's a good idea to get tested regularly. So I usually like to see when I'm working with someone, I like to see the testing like every 6 to 8 weeks, at the very least, like a thyroid panel. I mean, if you could do the antibodies every time, that's great. If not, at least every other time. So yeah, once when someone's trying to heal, I definitely want to see it more frequently. I mean, if they're doing it, sometimes I'll do it every month, which is fine, but again, I realize that's not possible for everyone for different reasons. So usually don't like someone to go more than a couple of months. without getting tested when they're trying to
I
heal.
agree. I agree wholeheartedly. I actually have a client who she has Hashis and alopecia, and her doctor said, diagnosed her with Hashis and said, "Oh, you're good. Just come back in a year and we'll retest you." What?
Yeah.
I was
Wow.
just like, no, this is wrong. And this is not some third world country. This is a European Union country, one
Mm.
of the biggest financial, heavyweights in the EU. I don't want to say, but at the same time, like having lived there, I realize and I know how so many other people are suffering with their situations and conditions because they're blocked. They're absolutely blocked. If I or they wanted more testing while living there, it's hard to get more testing. It's not like a PPO where you can just like order it, or you could just order it from your functional medicine provider and be like, I want this, and this, and that, Instacart it my way. It's not that way in Europe. It's not that way in a lot of countries. And so even, Canada has actually changed their laws when it comes to thyroid panels and actually getting testing from abroad, functional medicine testing. They're not allowing, they changed the law so much where it's almost functional medicine practitioners in another country, let's say the US, going to Canada, you can't get it. And they've blocked that. It used to not be that way because I have a lot of clients in Canada. Do you know anything about that? Because that's been a new thing where, you have to navigate with all these changing laws, but that also tells me that the Canadian government doesn't want their Canadian citizens to have access to a full thyroid panel, which limits them, limits their possibilities and the care that they get. Because once they have proof, like, hey, I have this, then guess what? The healthcare system has to act. And whatever that wait list looks like, but still, this is part of my angst with socialist and universal healthcare systems because they don't work and they don't work for a lot of people. And this is the problem is that people are going amongst their lives trying to, put the pieces together as much as best as they can, but a lot of times they're blocked. It's a horrible situation to be in.
Yeah, I agree. I mean, usually in Canada and a lot of times, yeah, in Europe, I mean, people will work. I mean, if you're trying to get these tests done by the universal health insurance, it probably won't happen. So usually they're working with another functional medicine practitioner. I mean, I have someone in Toronto who goes to Florida to get his testing just because he can't get what he needs, over there. I mean,
Yeah.
again, sometimes I'll have people in Canada work with another. Actually, it's not uncommon for them to work with another functional medicine doctor to get the blood testing, like you said, that they need. But sometimes, depending on where they live, they might be able to cross over the border. Europe, of course, is more of a challenge, to do that. They can't just come here and get the testing done as easily. But regardless, whether someone's in Canada, Europe, Australia, many times. I mean, even here. I mean, obviously here you go to your endocrinologist, and the endocrinologist sometimes they'll just do a TSH, or maybe they'll do a TSH and a free T4. And if you want to look at T3, reverse T3, the thyroid antibodies, they might do the initial thyroid antibodies, and that's it. There's a lot of times it's a fight. And so people still, even in the United States, they might have to go and pay out of pocket, work with someone else, or I mean, here, thankfully, there are places where you can just get labs on your own. So some people just order their own labs. But yeah, unfortunately, even in the United States, it's not like the medical doctors are willing to give them what they need.
No, no, they're not. It's very unfortunate. You have to really navigate this in a very strategic manner and be your own advocate 100%. So, what are some of the symptoms that somebody could look for if maybe potentially they are slipping down the road of Hashimoto's or Graves'?
Yeah, so with Hashimoto's, I mean, typically, we mentioned a few of those, fatigue, very common, weight gain, brain fog, coldness, hair loss, brittle hair loss, as you know, very, very common. Depression sometimes, constipation. With hyperthyroidism, it's sometimes the opposite. I mean, sometimes you'll get some overlap of symptoms. So you might still get fatigue because there's a lot of stress on the mitochondria. So someone might have with hyperthyroidism might have that wired but tired feeling. But weight loss, again, I lost 42 pounds, even though I wasn't trying to lose that much weight. And again, I can't say everybody loses that much weight, but again, some people will actually gain weight even with hyperthyroidism, Graves. So, you don't always get the classic symptoms, but the classic symptoms would be weight loss, tachycardia, so increased resting heart rate, heart palpitations, tremors, instead of coldness, like heat intolerance, instead of constipation, like loose stools, sometimes diarrhea, anxiety, insomnia, also hair loss, very common with really any type of thyroid hormone imbalance. And then also with Graves', a lot of people get what's called thyroid eye disease, where the immune system attacks the tissues of the eyes, and then so you might get bulging, you might get swelling, and sometimes double vision. And yeah, so those are some of the more common symptoms I'm seeing in both hypo and hyper.
What part of this does iodine play in our day-to-day diet and how important it is as a supplement? I know in Korea, for example, South Korea, they eat high amounts of seaweed and they have off the chart, quantities of iodine in their blood, so much so where their babies actually have the highest IQs amongst everyone in the world. And so there was a research paper that I read that it's because of all the seaweed, of all the algae, of all the fish that they eat on a regular basis, and hence the high IQ, but lots of iodine, like 13.5, iodine measured within their bloodstream. So how important is iodine in our diet and how we should be consuming it?
Yeah, another great question. I mean, iodine, definitely one of the more controversial topics in thyroid health because you'll get different perspectives with iodine. I mean, there's no doubt iodine is necessary for thyroid hormone production. If you don't have enough iodine, you will be hypothyroid. And so iodine's important. Really, the question is how much, because if you don't have enough iodine, then you could become hypo. If you have too much iodine, then, and again, you mentioned other benefits like iodine, also important for brain health, important for breast health. So it's not just the thyroid, it's important for other areas too. And that's why when women are pregnant in the thyroid space, some are really nervous about iodine, and they might, I've seen, it's rare, but every now and then someone will ask about a prenatal without iodine. I'm like, you definitely want iodine in your prenatal for the health of the,
Yes.
even if you don't want it for you, for your developing baby, and like you said, the brain health, you definitely don't want to get rid of all iodine. But even if you're not pregnant, you still don't want to get rid of all the iodine. And that's, you have some practitioners recommend, just like completely avoiding iodine or really just greatly minimizing it. And then you have other perspectives where, just trying to consume large amounts of iodine or take iodine as part of like a supplement like 𝐬𝐮𝐬𝐫𝐞 solution or iodoral. I'm somewhere in between. I mean, I started out when I dealt with Graves' back in 2008, and I was attending those seminars I mentioned. Prior to that, they were definitely more pro iodine. They were like talking about the importance of iodine and like in both hyperthyroidism and hypothyroidism. And so when I dealt with Graves', I actually had a pretty good experience with iodine supplementation. I did like a urinary iodine test and it showed I was deficient. And then I supplemented with iodine and had no issues. And, I mean, some people do definitely have issues. So you do want to be careful and there could be reasons for the issues. And then, so I guess just to summarize now, like fast forwarding, I don't recommend like completely excluding iodine, and I'm not like super scared of iodine, but I do think some people do need to be cautious, like about like taking really massive amounts of like iodine supplements. I think getting iodine through food sources, and even if you're taking a multivitamin like with iodine, I don't really get nervous about that. It's just like, again, if someone's taking like milligram doses, like 50 milligrams, 25, 50 milligrams of iodine. And again, I did that in the past and I did okay. So there's people I could definitely be fine
Handle it.
doing that. But then there are people where in some cases that could exacerbate hyperthyroidism. Sometimes that could exacerbate the autoimmune response because it does cause oxidative stress. Now, again, there are things you want to do like take selenium and yeah. So it's, like I said, you could go back and forth between risk versus benefits, but I'm definitely not anti-iodine, but I am cautious. Even though I had a really good experience with iodine, I am cautious because I've had people where, they supplement with iodine and it causes like a flare up. And again, there could be reasons for that. But yeah, so again, I hate taking the middle ground because again, like there are people that are like one side or the other. But like I said, in the case of iodine, I like iodine, it's important, but I am cautious when it comes to iodine supplementation.
I'm actually a huge proponent of iodine. I actually think it's extremely necessary. And if you, which I'm sure you're very well aware of, but this is more for the listeners, if you go back into researching in history and seeing how before in the American system of our food system, we had and used iodized salt for everything. It was in restaurants, it was in our normal cooking, it was everywhere. And so everyone had their normal amount of iodine that they needed on a daily basis. And lo and behold, back then in the 40s, 50s, 30s, there was no Hashimoto's, there was no Graves' disease. And then lo and behold, they took it out. And so now what you get at restaurants and at normal supermarkets and fast food and everywhere else is just regular table salt, which does nothing for you except for increase your diseases, your heart disease, your cancer rate, and everything else. It does nothing for you. And if anything, it probably has plastic in it. And so that's the situation, is that we've secretly taken out iodine from our meals and our food supply. And this is where it's led our increase, I believe, in the autoimmune disease situation, but then also a lack of working thyroid too, because we're not checking on it. We're not getting iodine. A lot of people don't eat fish, right? If you look at especially the interstates, right? I've lived in 5, 6 different states, and the coastal ones, California and Florida, eat tons of fish. But you go into the middle, right? You're not going to find so much fish. People in Iowa, Idaho, all these places, they're not eating a lot of fish. Maybe Minnesota, because you have the Great Lakes and you have a lot of fish and lakes, but everywhere else in the middle, it's, Colorado, which another state that I lived in, bison, elk, beef, it's so different. And so a lot of our situation too comes from where we live. And so that's cultural of where you live. And so whether it's the access to seafood, good, healthy seafood, or whether it's your likes or dislikes, but as a whole, we're eating less and less and less, algae and seaweed. That's not part of our repertoire here in the US. And in Japan, where I also lived, okay, yes, you're doing sushi and you're doing a little more of seaweed and nori and whatnot, but at the same time, it's still not huge amounts. Like, let's be honest, I wasn't, gorging on this stuff. And so you see a big difference of what's possible. And to me, it's very clear that through the diet, it was very complete before, and now it's not. And so now, in general, we're at a deficiency level that has dipped us into a situation where, a lot of people are crawling back up, trying to get out of this hole and out of this mess that we're in. Would you agree?
I would agree. Yeah. I mean, I won't name names, but like I said, there are practitioners out there who pretty much, recommend to completely avoid iodine or to keep it like less than 200 micrograms in like everybody. And yeah, and I definitely don't agree with that. One question I have for you, do you do like urinary iodine testing, or do you just assume that people are deficient and just, I guess, do you test for it, or do you just
I think
have them
iodine is
supplement?
necessary. And so, I mean, I think that you could look at things through the lens of, am I eating fish or am I not? And then it's almost like a tree diagram. Like if you're eating fish and seafood and a regular, then you go this way. And then maybe you don't need a supplement. But if you're not eating fish and seafood, well, then because maybe you have an allergy, an aversion, or whatever it is, well, then what else are you doing to move the needle? And so I think we need to start there and evaluate, what are we doing? Something as simple as cooking with iodized salt. That could just take away a situation. It could also support a situation. So, instead of buying just regular table salt, buy iodized salt. Or, for example, when I was pregnant, I also supplemented, not just outside of the prenatal, but I supplemented with a bunch of other supplements, including iodine, because I know it's so fantastic for brain health and the developing brain. And so you want extra because guess what? You're creating a body there, which needs it. And I mean, I can't necessarily prove anything, but I will say, and maybe this is just me being a mom, but my son is so smart. I mean, yes, he's 5, but I do believe he's so smart. And so, sounds bad, doesn't it?
No, I mean, hey, you're a mom, we all have, as parents, we have to brag about our kids. And again, the
But
iodine,
that's all I can
yeah.
say. I see a difference between him and his counterparts in preschool or in kindergarten. I see a difference
Hmm.
of, just how they maneuver, how they go about, how they follow directions, how everything, like they understand concepts a lot quicker. And so I see this in him. And so I think there's a lot more to it. I will say too, is that for any female having breast pain on the side, especially around your menstrual cycle, this is also a sign of iodine deficiency. So if you were to supplement even just a little bit more, you would see that breast pain or the tenderness go away. And so it's these things that our
Yeah,
body
with the
tells us,
fibrocystic breast, yeah, definitely.
but we don't know, and we can't like we don't know to put these two things together until we're already at a low deficit. And so it's one
Yeah.
of those things like you don't know until it's almost too late. And thankfully, you and I and the people who we help are all recovering from their own situations. And so what are some of the things that you recommend people do once they have a diagnosis of Hashimoto's or Graves or any other thyroid condition?
Yeah, so I mean, we definitely want, well, incorporate the foundations of healing, so healthy diet. And I mean, we could talk about diet. There's not one single diet that fits everyone perfectly. Stress is huge. Chronic stress is a big factor. So we want to, I mean, if we can reduce the stressors, that's great. But at the very least, try to work on managing our stress handling. Sometimes we need to go beyond that and incorporate like vagus nerve exercises or even like nervous system retraining. But, so diet, stress management, proper sleep, regular movements. I mean, those are the basics. One thing which doesn't really, it's not part of the healing, it is part of their healing journey, but being safe. And what I mean by that is while you're addressing the root cause, if you have, let's say, hyperthyroidism, you don't want unmanaged hyperthyroidism. You want to do something to lower thyroid hormones. Traditionally, I mean, typically they'll recommend anti-thyroid medication. I mean, sometimes surgery, radioactive iodine, but which you definitely don't want that. But the anti-thyroid medication, again, I was able to avoid the medication, and if you could avoid it, like there's herbs that you could take to manage the symptoms of hyperthyroidism. Specifically, I don't know if you heard of bugleweed and motherwort. They're not as common, those herbs, but I took those and they work great. They don't work in everybody, and if someone needs to take the anti-thyroid meds, which definitely some people do, that's fine. And then same thing with Hashimoto's. Again, thyroid hormone replacement isn't fixing the autoimmune component of Hashimoto. So there's a time and place for that, but the problem is that's the only solution that medical doctors give. So like if someone has really low thyroid hormone levels and they need, and again, maybe it's the iodine, they're low in iodine too. So that's something to consider, like what's causing it. But again, like I said, there's a time and place for symptom management while addressing the root cause.
What would you want anyone listening to know in regards to healing Hashimoto's or healing Graves'?
What I want them to know about healing Hashimoto's or healing Graves.
Yeah, so
I
let's
mean,
say they're listening to this podcast, they want to heal because they have a thyroid issue. What would you want them to know?
well, number one, understand that these are more immune system conditions and thyroid conditions. And I say this because most medical doctors, including endocrinologists, won't acknowledge, I mean, they'll acknowledge it, but they're not doing anything for the immune system. So they're going to focus on the thyroid. And that's kind of what we just said. They'll give thyroid hormone for Hashimoto's, and that's all they're going to do. And then for hyperthyroidism, they'll just focus on the thyroid. And then of course there's hope. There's hope to reverse the autoimmune component, just like there's hope to reverse autoimmune causes of hair loss, which you do a wonderful job of and been helping people for a long time with. Again, the same is true with other autoimmune conditions, including thyroid autoimmunity, including Graves, Hashimoto's.
That's fantastic. So where can we find you, Dr. Osansky? Where can people find you, listen to you, reach out and contact you?
All right, thanks, Johanna. So I have a podcast which you're also a guest on. So saymythyroid.com. And you could just click on podcast or visit your favorite podcast platform and definitely check out the conversation I had with Johanna. And I have a few books. So I have two on hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease, hyperthyroid healing diet, and then Hashimoto's triggers, which you could find on Amazon. And have a few newsletters. I have a healthy gut, healthy thyroid newsletter, 𝐸MyThyroid.com/newsletter. And then I have a Healing Graves newsletter on Substack, which you could check out by visiting 𝐸MyThyroid.com/Graves newsletter.
Fantastic. Any last parting words? If I was in those shoes of someone who was going with thyroid issues or, even with the hair loss situation, are there any parameters that you can give them? Like it'll take this long to do XYZ and it'll take this long to go into remission. I know it'll look different for everybody, but is there anything generalized that you've seen within your practice of people in general?
I mean, it'll typically, yeah, it could take a while to get into remission. I know like with you, I believe it's like 8 weeks before people will like really see some good changes with the hair loss, right? So, and I think when it comes to healing autoimmunity, other autoimmune conditions too, when working with people, I hope within 2 or 3 months to really start seeing some positive changes in the right direction. You probably won't be in remission in 2 to 3 months, but you should know what we're doing is working. And then it depends. It took me like 9 months to get into remission. Some people it could take less time than that. Some people a little bit longer. But it definitely shouldn't take that long before you know that it's working, that it's helping.
That's fantastic. 9 months. I wish it was that quick for me. It took me 4 years, but
But you learned it doesn't take everybody now 4 years to do that. Yeah, with me, I guess it was my first experience dealing with me, and it could, yeah. So I guess I was lucky with that. But at that time, it was still long for me. But yeah, 4 years, definitely a lot longer.
yeah, 4 years was definitely a huge challenge, but 9 months sounds wonderful. And this is why it upsets me so much that most doctors nowadays just go off of the medications and they're quick to serve you that instead of say, look, all we have to do is change diet and lifestyle, look at some things, test here and there, and boom, in 9 months, in 12 months, even if it's 2 years, that still saves you so much angst of not just having the one thyroid issue, but then also opening the door for a second, third, or fourth autoimmune disease. Changing diet and lifestyle is not just the healing, but it's also warding off all these other health concerns that could be looming, that could be coming your way. And so it's such a no-brainer. I mean, such a no-brainer in my
Oh,
perspective.
I agree. I agree. It definitely you're at risk of developing other autoimmune conditions in the future if you don't address your current one. So yeah, it definitely makes sense to us and hopefully it makes sense to your audience after listening to this.
Yeah. Well, thank you so much for coming and for sharing your wisdom and your insight into thyroid, Hashimoto's, Graves, and other conditions, and how we can approach naturally and heal and reverse this. So, thank you so much, Dr. Eric Osansky, once again, for your time and for your wisdom.
Okay. Thank you. Thanks again, Joanna.
Thank you so much for tuning in. Please share this with anyone you think would benefit. We all know someone with hair loss, and there is a way to fix it without medications, gimmicks, and confusion. A streamlined approach is possible for high hair growth performance.